Although silicone oil removal is not as flashy as other retinal procedures, performing it correctly is crucial for achieving a good outcome in your patient's treatment. The beginning of this surgery is similar to any vitrectomy procedure, placing the trocar 3.5 to 4 mm from the sclerocorneal limbus, placing the infusion line and verifying that it's in the correct space. Now, silicone can usually be removed with a special syringe connected to the vitrectomy equipment or manually. If you have the option to do it automatically with this special syringe, I recommend it as it helps maintain a better balance between the amount of silicone or material drain and the filling on the vitreous cavity. As first, you will notice silicone coming out and there will be no movement in the cavity. This is where patience is key. Once you have aspirated approximately 20% of the silicone, you will notice a laminar flow with a light reflection. Once you reach this point, you will see a slight turbulence when the rest of the silicone separates from the posterior pole, and you will start to see movement and greater dynamics of particles and bubbles moving towards the aspiration area. Once you see the wedge of the silicone bubble, a good tip is to slightly displace the eyeball downward to encourage this bubble to flow towards the upper portion where you are aspirating. I always monitor the cavity here because you may inadvertently draw in BSS and collapse it. That's why I always visualize the tip of the trocar where I'm aspirating to ensure that I'm always within the silicone bubble. Once you have aspirated the central silicone bubble, comes the part of the cavity flushing. I usually do an average of 3 to 4 flushes depending on each case. I know, sometimes this step can feel tedious and repetitive, involving liquid to air exchange 3 to 4 times. However, it is essential for ensuring the complete removal of all the silicone. Take a look how there is still some silicone oil in the surface of the solution, even that I have performed one washout of the vitreous cavity. Now, moving the aspiration piece in and out of the solution facilitates the capture of the oily material. Even after the third washout of the cavity, oil is still visible on the surface. That's why it's important to perform these steps more than 3 times. It all depends on how clean the surface of the solution looks after each washout. In the last washout, I took the opportunity to apply brilliant blue and perform a membrane peeling. This isn't always necessary in such cases, only if you notice it's worthwhile and if the macula doesn't appear too ischemic. After the peeling, the fourth and final washout of the cavity is performed. Note how there is no longer any oily material on the surface. This is how you know the cavity is clean enough of silicone and you can finish the case. It's not necessary to leave gas, I usually just leave air, though it depends on each case. Thank you for watching, I hope this will be helpful.